But let's talk about the 4-chamber view. That's why we're all here today. And I'm going to turn it over to my partner, Amy, and she's going to carry us forward from here.
All right, yes, let's talk about the 4 chambers. So before we actually get into that 4-chamber view, there are a few things we have to identify first. So let's identify the fetal position. So how is this kiddo laying? Is baby cephalic, breech, transverse? So once we identify position of baby, then we can look at situs. We're gonna look at cardiac situs, and then we'll look at visceral situs. And here, we're gonna show visceral situs. So, liver-sidedness, making sure that liver is on the right side of the body. Stomach on the left. Aorta on the left. And then that IVC on the right. Spleen is going to be on the left, just posterior to that stomach. So it's important to remember that if we have any abnormal arrangement of the organs, there's a very high incidence of congenital heart disease. So here's a nice sweep up that transverse abdomen and going up into the chest. So baby was cephalic, so we're seeing stomach on the left and that apex of the heart pointing towards the left, aorta on the left, and then I just want to point out that portal vein, how we have that nice C curvature into the liver there. So making sure that goes towards baby's right into the liver. All right, so let's look at cardiac positions also. So here we're looking at which direction does the apex point. So normal position of the heart is going to be levocardia, so that apex points left. And then you can have different ways the apex points. So there's mesocardia, which is that apex points midline, and then there's dextrocardia, where that apex points towards the right side of baby, which both of those are abnormal. Okay, this is a great diagram of the 4-chamber. So let's look at, we can see the heart position, we can see the axis of the heart, the size of the heart, and then we'll look at the ventricles. So here we're looking at the symmetry between chambers, and then the symmetry between atria, and the offset of the AV valves. And here we're going to look at morphology of the ventricles, and then here the pulmonary veins dumping into that left atrium, just showing that all of that is normal. And also look at the septum for septal integrity. And the foraminal flap contour, make sure it's opening into that left atrium. All right, so size of the heart. So most sonographers eyeball it, I believe. So we look at that chest and does it look normal, right? We should be able to fit 3 hearts in that chest. So think the rule of 3s. If you suspect the size might be abnormal, throw calipers on it. We can get a cardiac thoracic circumference and prove if it's normal or not.
Yeah, and in different people, Amy, I've seen in the past do it differently. Some do a normal circumference ratio, and if you're going to do a circumference, then it's typically 0.5 or less is normal. And if you're doing an area ratio, then like you said, about 1/3, so about 0.3 or less is what we consider normal.
Okay, perfect. So yeah, so you can look at that in 2 different ways. Thank you, Jason. All right, and we have the cardiac axis. So normal axis, apex points left, 45 degrees to the left, approximately. And then even with this, if you're suspecting that the axis is off, just use a 2-line angle to check. So 1 line goes through the mid-spine to mid-chest, and the 2nd line goes through the septum of the heart, and you can check it. It's just another tool we have in our toolbox.
And like we talked about earlier, I've found over the years, when you have a grossly abnormal cardiac axis, either rotated to the left or to the right, you really need to be thinking about extra cardiac anomalies. We started this talk by saying, if you have an extra cardiac anomaly, think about the heart. Here, if you have abnormal heart axis, you should really think about maybe some other things that are going on. Out of my wheelhouse, but in all of yours.
Yes, you're absolutely right. We start thinking, what is the differential diagnosis for this? Why is it being pushed?
Yeah.
All right. So here is a beautiful clip just showing those 4 chambers, and we're going to look at symmetry. So let's look at symmetry between the atria. They should be equal in size, and then symmetry between the ventricles. And then in utero, both of the ventricles really form that cardiac apex. All right, so we're gonna let's talk about the different views that can be acquired to assess the 4-chamber. So the first view we're gonna look at is the apical view. In this view, we have our ultrasound beam is parallel to the septum. And we get, or we need to really just be mindful, because there is an artifact that we can get in this view, dropout artifact. So even though this is the really pretty view, see here, we see the arrow is pointing towards what could either be a VSD, do we have a hole in the heart, or is it just that dropout artifact? So be very mindful of that. All right, so this is a beautiful sweep from the 4-chamber view, and we're sweeping up towards baby's head, so sweeping cephalic. And I love this view because we see so much in it. So we start with that 4-chamber, and then we're gonna go up and we see those outflow tracts cross. So we always wanna see the crossing of the outflow tracts. And then this is a very similar sweep, but we're really gonna get into that 3-vessel view. So 4-chamber, outflow tracts, 3-vessel view. And the 3-vessel view is so important. It tells us so many things. You know, we're gonna look at first the number of vessels, okay? And then we're gonna look at the position of the vessels. From left to right, it should go pulmonary artery, aorta, and then SVC. And then just behind the SVC is the trachea. It's also important to look at the size of the vessels. So pulmonary artery is going to be the biggest, then aorta, then SVC, which we never want aorta bigger than pulmonary artery. That should be a huge red flag.
And Amy, you taught me something about this view, about an acronym that you use, PAST.
Yes.
And I love that. Why don't you tell them about PAST?
Oh yeah, so to help me remember this when I was learning, I would always think PAST, so P-A-S-T, so think left to right. So pulmonary artery, aorta, SVC, and then trachea. So it's just posterior to that SVC. And that was just a helpful little hint. And then this is another clip really focusing in on the 3-vessel view. And this is a wonderful clip because we're looking at arch-sidedness here. We can prove that it's a normal, you know, left arch for the aorta. And then we're also seeing that ductus come in. And then also in this view, we can see the trachea.
Yeah, this is a great view because arch-sidedness, that may not be something you think about on a cardiac screen, but it's a really critical piece of information oftentimes in the postnatal management of patients with congenital heart disease. So it's a great view.
Yes, love it. All right, so we talked about the apical view. So now let's talk about the subcostal view. So this view is obtained when the baby's laying on its side body, and we have that ultrasound beam perpendicular to the septum. So this is where we want to assess septum. We get our best sensitivity of Doppler here. If you were suspecting a VSD in that apical view, this is the view you want to go to. So here you see a VSD, and this is closer towards the apex, but Jason, will you point to where we would have been looking if we saw, yep. So if we were seeing that dropout artifact, this is kind of where our eye goes.
Yeah, that's a great point, because so many times in that apical forechamber, this membranous and perimembranous area of the ventricular septum, you just get complete dropout. And when you go into a subcostal approach, again, like you said, perpendicular to that beam, you can see the septum is nice and intact all the way to the aortic valve annulus. So it's great. And like you know, we all know the fundamentals of ultrasound, right? We need to be parallel to flow to maximize the sensitivity of our equipment. And you can see nicely the bidirectional shunting there and this muscular VSD.
Beautiful.